Hello and welcome to Good Life, the health show with me, Reshma Heather. Well, did you know that India has earned the unfortunate distinction of being the diabetes capital of the world, with around more than 101 million people living with diabetes, found a recently published study by the Madras Diabetes Research Foundation and the Indian Council of Medical Research. Well, what's concerning is that the average age of the Indian population diagnosed with diabetes is almost 10 years younger than the Western population. And interestingly, obesity is one major factor. And to answer these questions related to diabetes and how obesity and diabetes are related, we have with us Dr. Pranab Pathak, and he is one of the best diabetologists in Guwahati and is currently associated with Namecare Hospital. Well, welcome to the show, doctor. Well, as I have stated about the India has globally topped being the national capital of diabetes. So what do you have to say regarding this?
So diabetes is a global endemic and it's increasing worldwide. The numbers have increased exponentially over the years, and it's not very happy to say that India is a diabetes capital. We are just next to China, and there are a lot of reasons for this increasing trend of diabetes, which is being prevalent in not only in India but worldwide. The most important, of course, remains the lack of physical activity, sedentary lifestyle, improper food habits, and there are also some other attributing factors which can go hand in hand with diabetes, such as diabetes can coexist with cardiovascular disease, increased cholesterol or dyslipidemia, and obesity is also one of the growing concerns which really needs immediate attention so that we can tackle the problem of obesity related to diabetes.
So saying that, would you like to explain us more about how obesity and diabetes are correlated?
Yeah, there's a very strong relation between obesity and diabetes. Obesity is increase in the abdomen, increase in the fat, and that is mainly increase in the visceral fat. There is associated increase in the weight gain, and the patients who are having diabetes, they are at increased risk of developing obesity, and simultaneously patients who are also at obese, they are also at increased risk of developing diabetes at one point or the other. Not all patients who are obese will end up with diabetes, but as I've said, that if the lifestyle is not proper, then there is a strong tendency of obese patients developing diabetes. Now again here I would like to mention that especially type 2 diabetes is very strongly associated with obesity, and one of the important attributing factors is the insulin resistance or the metabolic syndrome which is present in the type 2 diabetes, and many a times this increasing trend of obesity is because of unhealthy lifestyle, lack of physical activity, and most of the patients do not exercise on a regular basis. Of course, genetic factors, family history also has to be taken into account, but there is a strong relation between diabetes and obesity. And if we don't tackle the problem of obesity, then these are the patients who can end up with diabetes. And also pre-diabetic group also needs special attention, because if the pre-diabetic group does not intervene, or if they do not change their lifestyle, then they can develop into full-blown diabetes. That's why we have to maintain a good healthy environment, and we have to counsel the patient regarding the importance of physical activity. So the relation between obesity and diabetes is very much there.
Well, also coming to the fact that we have known that diabetes has grown in numbers as it comes to our country. So we also have the study and records that obesity has also increased in the same manner. So isn't it common these days? Don't you agree,
yes,
doctor?
Yes, that is very true. I think diabetes is increasing worldwide, and same for obesity. Obesity is also increasing, and as I've said, that it is mainly attributed to unhealthy lifestyle, people taking a lot of junk foods, they're not doing regular amount of exercise, and of course over the last 2-3 years during the COVID time, when people were staying indoors and they were not doing their regular physical activity, or they were not hitting the gym, or they were not going for regular walking. So this is why over the last 2-3 years COVID was also one important aspect why there was an increase in the number of patients landing up with obesity. But again, as I've said, that genetic factor is also there, familial history is also there. Those patients whose parents are obese, there is a tendency of the children to develop obesity unless they change their lifestyle or they make some changes in their dietary patterns. So overall, if we see statistically, the number of patients who are diabetic or who are non-diabetic, the obesity is increasing, patients are putting a lot of weight, and this is inviting a lot of other problems such as increase in the cholesterol, increase in the blood pressure, people ending up with heart issues even at the younger age. So the burning issue of obesity needs to be tackled very soon.
Okay, so this is a very simple question. We know how to check a BMI, but if I had to ask you, like, how do you assess or measure obesity?
Yeah, body mass index is an important assess to measure the obesity, and it is measured by taking into account two parameters. One is the weight of the person and one is the height. So the formula is body mass index is equal to weight in kg divided by height in meter square. And for patients to be diagnosed as overweight globally, the BMI has to be 25 or more. But for patients who are from India or Asian countries, for them the cutoff is on the lower side. Any patient who has a BMI of 23 or more is considered to be overweight, and more than 25 is considered to be obese.
Now, we'll get back to you, doctor, and we have a call right now. Hello.
Hello.
Hi, apuni ki khudhibo bicharise?
Hoy, apnalokor sokumot sai asu. Because more daughter mane sugar patient hoy. Teketor recently sugar mane bahut high hoy geche. Etia mane keneke mane nahi koribo mane tu mane khudhibo lagisil mane sangok.
হয়, আপোনাৰ প্ৰশ্নটো বুজি পালো। আপোনাৰ দেউতাৰ সুগাৰটো বৃদ্ধি পাইছে, হেতুৰ কাৰণসমূহ আমি বাছি উলিয়াব লাগিব। তাৰ কাৰণে আপুনি এজন চিকিৎসকৰ পৰা উপযুক্ত পৰামৰ্শ ল'ব লাগিব। এতিয়া সুগাৰ বাঢ়া বুলি ক'লে আপুনি কিছুমান চিকিৎসকৰ পৰা উপদেশ লৈ পৰীক্ষা কৰিব লাগিব, যেনেকৈ ফাষ্টিং ব্লাড সুগাৰ, তাৰ পিছত আহাৰ খোৱাৰ 2 ঘণ্টাৰ পিছৰ যিটো ব্লাড সুগাৰ হেতুক আমি পোষ্ট প্ৰেন্ডিয়াল ব্লাড সুগাৰ বুলি কওঁ। আৰু এটা আমি প্যাৰামিটাৰ চেক কৰোঁ, হেতুক কয় গ্লাইকোসাইলেটেড হেমোগ্লোবিন বা HbA1c, য'ত আমি সুগাৰৰ 3 মাহৰ এভাৰেজটো চাওঁ আৰু তেতিয়া আমি গম পাওঁ যে তেখেতৰ ডায়াবেটিছ কিমান দিনৰ পৰা আছে। এতিয়া যদি তেখেতৰ সুগাৰটো বৃদ্ধি পাই আছে, তেতিয়া হলে সুগাৰৰ লগত আৰু কিবা আনুষংগিক ৰোগ আছে নে নাই হেতু জানা উচিত, যেনেকৈ হাই ব্লাড প্ৰেছাৰ বা কোলেষ্ট্ৰল। আৰু আপুনি চিকিৎসকৰ পৰা পৰামৰ্শ লৈ পেলাই চিকিৎসকে আপোনাক উপযুক্ত উপদেশ দিব যে তাৰ কাৰণে ঔষধ গ্ৰহণ কৰিব লাগে নে নালাগে বা শাৰীৰিক পৰিশ্ৰম কৰিব লাগে নে নালাগে। এইখিনি বস্তু আপুনি চিকিৎসকৰ পৰা ততালিকে উপদেশটো লোৱাটো উচিত। তেতিয়াহে আপুনি গম পাব যে তেখেতৰ যিটো মধুমেহ বা সুগাৰ কিমান বৃদ্ধি পাইছে আৰু তাৰ কাৰণে তেখেতে কি কৰা উচিত বা অনুচিত সেইখিনিৰ সঠিক পৰামৰ্শ লোৱাটো অতি আৱশ্যক।
Exactly. So, doctor, coming to the next question, what are the complications if someone is suffering through obesity?
Now, obesity itself is a very important risk factor. Now, there are a lot of complications that can develop if we don't tackle obesity or if the patient is obese for a long duration of time. For example, the patient may land up with heart issues. The patient may have an increased risk of developing dyslipidemia or increased cholesterol, which we say, and which again can be a very important attributing factor for development of heart disease, development of myocardial infarction or heart attacks. Then patients who are obese can also have some problems in weight bearing, especially osteoarthritis. Then they can also have some other lung associated problems such as asthma. Then they may have some breathing difficulties, COPD. So all these can be attributed to increased obesity. Again, obesity can also lead to the development of gallbladder stones. It can also be an important factor of certain cancers. Then some patients who are very obese, they also have difficulty in breathing during sleeping. This is known as obstructive sleep apnea. So these are some of the common complications which can occur in a diabetic patient who is obese and whose obesity is not taken care of, or who is still obese and has not cut down the weight. That is why it's very necessary to reduce your weight and keep it under control, and at the same time monitoring your blood sugars and keeping the blood sugars in control is very essential.
So now that we have talked about the complications of some of the patients who are going through obesity, so coming to a very interesting and trending issue, like it's a digitization era, and there are influencers and the mass people talking about the body positivity and also standing against this body shaming. So do you think it's a good thing that people are standing for this good reason, but do you also think at the same time like this will hamper people to lead a healthy lifestyle?
Now, this again will depend on patient to patient, or for that matter person to person. I mean, it cannot be generalized. You have to know your own body, your own physique, and based on that, you have to make some modifications. You at the same time, you cannot imitate everyone. You have to have a regular healthy pattern of eating, and at the same time you have to exercise regularly. You cannot be overweight, or if you are overweight, it is very necessary that you cut down your weight. Now you have to measure your BMI. That is very important. That is the first important issue. But along with that, it is very necessary that whenever we see patients, we also have to keep in mind whether he or she has some other associated disease or not, whether he has some heart disease, whether he has some arthritis, whether he can walk properly, whether he can do regular amount of physical activity. We have to advise that amount of physical activity which his body permits. So you cannot be overweight, and at the same time it's not advisable to be underweight also, because you can land up with nutritional deficiencies. This can again invite a lot of disease. You can land up with infections, and you can be more prone to develop any sort of respiratory infections, or for that matter any other infections. So being underweight or being overweight is not the right choice. You have to know your own physique. You have to consult your physician. If required, you can also take the help of your dietitian, because your diet will really play a very important role as shaping your body and keeping your sugars and your other blood parameters under control, especially your cholesterol, your lipids, your hemoglobin. All these have to be kept in mind. So it's not just about the weight. We have to look the entire person as a whole, and in order to prevent the complications and in order to make him or her lead a healthy, productive life, he or she has to keep his weight under control, and at the same time also has to stay fit, because that is very important at the end of the day.
True that. So we have some more interesting questions coming up, but we'll take a very short commercial break. Stay tuned. Welcome back, viewers. You're watching Good Life, the health show with me, 𝗟𝗡𝗎 Pathak, and we proceed with more questions on diabetes and obesity. So, doctor, since we have been talking about this big topic today, so what do you have to say regarding childhood obesity?
Now, this is another important burning issue, childhood obesity. We know that children should be physically and mentally very active. At the same time, we don't want them to put on extra amount of weight. Now, it has been seen of late that a lot of children are putting on more weight, and the reason perhaps is lack of physical activity. Instead of playing outdoor games like cricket, tennis, or for that matter football or any other outdoor games, now children are more comfortable in playing with electronic gadgets, be it laptop or mobile or the computers, and they'll be playing these outdoor games in an indoor format rather. So that the lack of physical activity is one very important attributing factor to increased childhood obesity. At the same time, I think children are also taking a lot of junk food. Previously, children were not taking that much of junk food, and it was not that easily available. Now the junk food are easily available. They are taking a lot of increased fat, and taking these junk food at regular intervals will enable them to put on extra amount of weight. These are the two primary attributing factors for childhood obesity. Of course, as I have said earlier also, genetic and familial factors also have to be taken into account, but we have to advise the children to do some physical activity, to play a lot of outdoor games, and to also reduce the amount of excess fat consumption which they take, excess amount of calorie intake. Now, it is very necessary that they seek the help of a proper dietitian, and an appropriate calorie count should be done, because as per the weight and height of the child, if we know that this is the total amount of calorie he or she should consume, and if he is consuming in excess, then the parents especially should check their excess consumption of calories, and they should advise their children that, look, this is the amount of food you need to take, you have already crossed, so you need to cut down. Again, it cannot be done in one single day.
True.
You have to be consistent in your level of regular physical activity. Discouraging the children again will not be a very very good factor. You have to explain to them in a very simpler manner. You have to explain to them very easily so that they understand and they don't land up with depression. Children are very fragile to develop depression, and they should be tackled with a lot of love and tender care. This is why tackling childhood obesity is very important, because if you don't tackle this problem of childhood obesity, then after a couple of years they will be at increased risk of developing other diseases. Say for example, they will be at increased risk of developing diabetes, cardiovascular disease, then other associated increased chances of developing dyslipidemia, increased cholesterol. So all these diseases will start growing to develop slowly. So we have to be very vigilant, and we have to be alert so that we can prevent them from developing complications later on in their life and enable to lead a healthy, productive life. Even the school authorities or school teachers can be also very helpful in making the children understand what they should do, what they should not do, and we have to advise them very fruitfully so that they can tackle the problem of childhood obesity.
So now that we have talked about the childhood obesity, do you have any history in your span of work that you have successfully treated a person to a healthier lifestyle?
We do get children, no doubt they do visit pediatrician.
Yeah.
So they take the guidance and help of the pediatrician, but sometimes patients who develop diabetes or who develop other metabolic diseases, and they do come to us, and especially obesity also, whenever we advise them, then if we make them understand the consequences, they do accept it, and they understand the complications that can arise. And there are examples of we treating such children and bringing back them to normal weight from overweight. Again, underweight is another separate entity altogether. So we have to make the child understand that this is the amount of weight, this is the level of physical activity you should do.
Well, doctor,
so
we have another call coming in all the way from Manipur. So, hello. Hello, what would you like to ask, doctor? Hello, if I'm audible to you, what would you like to ask the doctor? So, we'll try and reconnect. We must have lost the signal. So, continuing with the question, like...
Yeah, so this childhood obesity, we have treated children and we have got good results. It's very encouraging, and they also feel very happy. Once they lose the weight, there is a sense of satisfaction and a sense of a good, happy well-being in the children, especially when they lose weight and when they attain a good, healthy weight. And they also feel that they are now more physically fit. So encouraging them to do regular physical activity, playing outdoor games, and reducing the intake of junk food and excess calorie consumption can be of real help.
Okay. So coming to this factor, you have already answered, but I'll still ask you, like, how do you restrain yourself from being into obese category, or what are the developments you can do for yourself initially?
So whenever we get any patient who comes with obesity, and whether he or she suffers from any metabolic disease, first of all, we need to take a detailed history.
Doctor, I will interrupt a little. It might be like whole range of age, like from the teenagers to adults,
to
or
even
the old
elderly,
age,
yes.
elderly people.
So it is very important that you take a proper history from the patient regarding his lifestyle. Right from the morning, from the time he wakes up until he goes to bed, the level of physical activity which he or she does, and the amount of calorie which he or she consumes, what kind of food he has. So that you have to keep in mind, and that you have to take a proper history. Along with that, we also do certain routine tests which are to be done, and by doing the important laboratory test, we can get an idea whether what level of physical activity he or she is doing, and what are the associated other comorbidities or other diseases like increased hypertension, increasing heart disease or cholesterol. So we can get a rough idea that these are the diseases he or she is suffering, and we have to focus on that. Counseling is very important. We have to encourage and motivate them to maintain an ideal weight. It is also necessary that we ask them to seek help of a trained dietitian who can give them a customized diet chart, because every patient is different. You cannot generalize it to everyone, So since every patient is different, a customized diet regime and a customized exercise regime is also given to the patient, and then he or she plans the entire dietary pattern accordingly and follows that. Now, one thing here I would like to say that whatever level of physical activity a patient does, he or she has to do it on a consistent pattern. It's not that you'll do 1 month and then you'll leave aside. So if you do that, whatever weight you have lost, you'll regain it back with interest. So it's very important that You do the level of physical activity on a regular basis, and that too on a consistent basis. At the same time, we also have to understand whether he or she has some other diseases. Say for example, if someone has arthritis, or say for example some difficulty in walking, we cannot advise him to run too fast, or we cannot advise him to do too much amount of physical activity which can hamper his or her other systems of the body. So proper analysis of the patient's body structure has to be kept in mind, and the calorie count, as I have already said, is very important, because then only we can get an idea that for this particular patient this is the total calorie for the day, and then we can divide the entire dietary pattern accordingly. Counseling is also very much important, because a lot of patients, we feel that those who are obese, they have a depression, lack of self-esteem, they suffer from other psychological issues, so they feel that they feel neglected, or they feel somewhat depressed. So it's very necessary that we have to make them open up. A lot of patients even feel shy to tell that they are obese, or they don't visit the doctor on a regular basis. Now this is also equally important, because whatever medications we give, whatever advice we give to the patients, if they don't follow the advice, or if they again leave the medications after taking the consultation, then again it can be difficult if they do not visit the doctor on a regular basis. So you have to be in touch with your physician on a regular basis, and at the same time we also have to see for other disorders which can again contribute to obesity or increase fat. For example, if they have any thyroid disorders, if they are taking some medications which can again increase the weight, say for example insulin can cause increase in the weight. So we have to keep a proper analysis, but again as I have said, every patient is different, so you have to deal with each patient in a different manner. Customized diet chart, customized exercise regime has to be given, and most importantly you have to boost in confidence to the patient, because that's very important, because if the patient develops confidence, if he or she feels happy, he or she will definitely follow whatever good advice you give him.
I think this answer is going to be very helpful for the viewers who is watching right now. So we have known about how we can physically help ourselves from being obese in the obese category and be mentally prepared. So has there been any surgical intervention for obesity?
Yes. First of all, patients who are obese, whenever, as I have said, that we take a proper history, then we ask them to make some lifestyle modification, which includes proper exercise and dietary modifications, taking appropriate calories in the desired order, and also doing a regular physical activity on a consistent basis. Now there are some medications which also are given to reduce the weight. These medications are helpful for the patient, but no patient should take this medication without consulting the doctor, because the doctor will decide as to how many days or for what period of time he or she has to take this medication. Now even with lifestyle modification and after taking the medication, if the BMI is still on the higher side, if we have not achieved the target BMI, or say it's above 30, or say for example, or say it's increasing to 35. So for that category of patients who also have some other comorbidities, we may ask them to go for some surgical intervention, especially bariatric surgery. Now bariatric surgery is required for patients who develop increased overweight or morbid obesity, having a very high BMI, and who also have some other comorbidities. So these are the category of patients where even with the best of the medications, even while adopting lifestyle changes, they are still not able to bring down their weight. So for them, surgery is the last intervention which they do. Of course, any surgery has its own risk, so we have to counsel the patient and make the patient understand that this bariatric surgery may be helpful, may be fruitful for you. We have to counsel the patient, and this bariatric surgery, it has been seen that after doing bariatric surgery, for a lot of patients, there has been decrease in the sugars.
So, all right, doctor, we are coming short of time, but that's all we have in this episode of Good Life, the health show. And thank you so much, Dr. Pranab Pathak, for joining us and enlightening our viewers on this big topic today. So keep watching Notice Live, and thank you for watching.